This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
Getting enough sleep is important in maintaining your overall health and well-being. It allows you to recharge, boost brain function, and help you retain vital information. While every one of us may have trouble hitting the sack from time to time, some may experience persistent sleep problems that may adversely affect their quality of life.
When you're sleep deprived, a lot of your functions are actually affected. Primarily your attention, your wakefulness is affected during the day. Because just imagine kung puyat ka, the following day you're tired, you can't think well. It also affects your immune system. Of course, apart from that, you have other problems that would affect your work, like your memory, your decision, and that can actually take its toll in your workplace.
Snoring, for instance, occurs at all ages, although it is most common in men and those who are overweight.
So the most common sleep disorders that we see are usually insomnia and snoring. Sleep disorders are basically anything that has disorders that occur in sleep. So either you have problems falling asleep, you have problems during sleep, or you can't get to sleep.
In most cases, may be a symptom of other medical problems such as sleep apnea, when a person stops breathing during sleep.
Deep in sleep, you choke during your sleeping hours, and you can choke several times in one night, and this eventually would lead to heart complications.
Some may also suffer from insomnia or the difficulty of falling or staying asleep, or even narcolepsy, a sleep disorder also known as daytime sleep attacks. There are various medications and treatments available, although the first step would always have to be proper consultation with a sleep medicine specialist.
And depending on the type of illness that you have, so we would recommend all sorts of treatment. Sometimes it could be a combination, depending again, as you said earlier, you can have multiple sleep problems.
How much sleep does a person need? What causes sleep apnea? Find out the answers tonight on MedTalk.
Joining us tonight is Dr. Romulus Estrella, sleep specialist and head of Capital Medical Center Sleep Center. Also joining us is Dr. Virginia de los Reyes, head of the Lung Center of the Philippines Sleep Lab and Sleep Disorders Clinic. Both of our doctors are members of the Philippine Society of Sleep Medicine. You may join the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening, Angel.
We're going to be talking about sleep disorders. Start off by asking, why is sleep important? Start off with you, Dr. De Los Reyes.
So sleep is very important because our brain need it for development. And it's also our time for the body and also the brain to rest when we sleep. And it's for the time for our brain to reinforce our memory and consolidate our memory. And it's also important for other things like even our immune system. You notice that if you don't sleep so much, then you're prone to having a lot of the colds and also these sinus problems. And sleep also, they're thinking that it's a mechanism for us to get rid of toxic metabolites that would accumulate during wakefulness. It's very important to have, even with our memory, even our moods. So we also notice if you don't get a lot of sleep, you can become very irritable during the daytime. And could also impact actually in your the way you think, your judgment, okay? Even your memory, concentration, all those things are affected.
So sleep is very important, very important.
Yes.
Do people think of it as important? Do your patients and the average individual think of it as important, Dr. Estrella?
Yes. Usually when you don't have a good night's sleep, more likely in the day that you're working, you have a poor concentration, You cannot catch up with what you're doing in the school or in the office. If you talk to somebody who's talking about business, you cannot even talk to them for almost 30 minutes to an hour because you fall asleep. So very important to sleep during the night. So what we call is we must have a good night's sleep to have a good work during the day.
And what does a good night's sleep mean? Does it mean uninterrupted sleep?
Yes,
Or-
that's uninterrupted sleep in the sense that you were able to sleep 6 to 8 hours during the night. And more often, you don't have the symptoms of snoring, more likely. Nobody is snoring beside you. And we call it as uninterrupted in the sense that you were able to sleep continuously. And that's the time when you wake up in the morning, you feel as if you were energized, you were refreshed, and you were able to work during the day. That's very important for the patient. Or even for us, it's very important.
How many hours of sleep do you get, Dr. Delces?
Okay, I think a lot of doctors would sleep less than 6 hours, but as Dr. Estrella said, it's about 6 to 8 hours. But the duration of sleep would also differ depending on the age. Like, for instance, newborns would probably need 18 hours of sleep.
Okay.
Right? And probably children would need more also, like 13 hours. Teenagers would need 10. But for 40 years old and above, probably around 7.5 to 9 hours even.
So it
Really varies
according to
age.
gender, age, occupation.
Even yes, for instance, your occupation really requires you to be awake most of the time, then you probably go with less sleep. That's why it's very important to stress that you really have to make time for sleep.
How many hours a day do you get to sleep, Dr.
Usually before I
Estrella?
sleep only for 5 hours. Now I have at least 8 hours of sleep during the day. So I catch up with 9 o'clock till 6 a.m.
I just wanted to mention, there was
Yes,
a
doctor.
study, nurses' health study. So this is a long-term study for about 14 years. And then they looked at what happens when people sleep too little or too much. Then they noted that the safest time would be around 6 to 7 hours, so the increased mortality. But if you sleep less than 4 hours or you sleep more than 10 hours, then there's increased risk for cancer-related deaths, also increased heart diseases.
So the lack of sleep
Or too much sleep can
or too
also
much
be a
sleep, no?
problem. Yeah.
Sometimes we think it's just a lack of sleep, but also too much sleep can be related to certain health conditions.
Yes.
Yes, that's true.
How about the health conditions brought about by the lack of sleep? Are there certain questions that an individual should ask themselves in order to figure out if they have a sleep problem? Dr. Estrella?
Usually, if you have lack of sleep, it depends on patient's work. Usually, patients would just have a lack of sleep because they go on gimmicks. And more likely, they are just doing something that is not really related to their work. So they go on gimmicks in the night. But the more important is, if you have a comorbid, if you are big, you're eating too much, you'll be gaining weight, what do you do during the day because of lack of sleep? You eat more because you want to energize yourself. So it will add more weight on you. It will add more of what you have. If you have snoring, it may lead to obstructive sleep apnea. So it's very important that lack of sleep must be seen by a sleep specialist.
Okay.
Because it could be something that may lead to other serious problems.
You mentioned snoring.
Yeah.
Snoring has become a big problem, not only in the country, but all over, no? All over the world. Why do people snore? What is it in their anatomy that blocks the regular breathing pattern? Dr. Estrella?
Usually the sounds of snoring originates from the oropharyngeal area, starting from the nasopharynx down to the hypopharynx or to the larynx. And because this is a collapsible area. And every time you have a low-lying soft palate, a big tonsils, a long uvula that vibrates, that's caused the snoring. This is the tissues that produces the sound. And you know, the most common generation sites of snoring is the soft palate. And the soft palate comprises the uvula, what you see at the center. You will see the pillars, and you will see the whole of the soft palate. And that's the most common. And the second most common that vibrates is your tonsils. It's very amazing that the tonsil vibrates, even they are fixed, but they vibrate. They are the same with the soft palate.
Okay.
Yeah.
So when the tonsil vibrates together with the soft palate,
Yeah, it causes sound.
is there a particular, well, parang is it a universal sound when someone snores like
Well,
that?
we have, it's like talking. You have different nuances of snoring.
yes.
But it's just basically a vibration of the soft tissue in your upper airway. When there's obstruction, there's going to be vibration of the soft tissue as you try to suck in air. So snoring by itself might be normal, but you have to rule out if it's already associated with the most common would be obstructive sleep apnea.
So before we cut to a break, what is normal snoring,
Normal
Dr.
snoring.
De Los Reyes?
If it's just occasional, then you could already identify certain triggers. Like for instance, you went out, you're so tired, okay, so you have a tendency that for your upper airway to be more relaxed than usual, especially if you take in a lot of alcohol. Okay, so if it's just occasional, or for instance, if you had a cold and then you'd have temporarily you'd have snoring. So that could be explained by that. But if you would have habitual snoring and very loud snoring, typically occurring almost every night, rouses your neighbor or your sleep partner, then that's already might be pathologic.
And that's a reason to go see your sleep specialist or your EENT or your pulmonary
Sleep
doctor.
specialist,
Sleep
as a whole.
specialist as a
Yes.
whole.
Yeah, as a
Okay.
whole, yeah.
Doctors will talk more about sleep disorders, all that and more when MedTalk returns.
A research team led by Karine Spiegel of the University of Lyon revealed that sleep deprivation can increase the sensation of hunger by 25%. So, go get some more sleep and you can munch more of your favorite food and burn more calories.
We're back here on MedTalk, still talking about sleep disorders. You may join the discussion by calling our hotline at 548-4678. Doctors, before we cut to a break, we were talking about snoring. I just wanted to ask, snoring and another sleep disorder called sleep apnea, are they one and the same? And what are their differences?
They're not the same. Because usually when you say just primary snoring, okay, or occasional snoring, then that might not be a problem. It just happens when you have the triggers that I've mentioned earlier. Okay, but if it's a habitual snoring, very loud snoring, then it could already be a symptom of another condition, which is obstructive sleep apnea. And it's the most common symptom actually for sleep apnea. So when you have sleep apnea, there's obstruction of your airway. Then that's the reason why you snore.
Is the sound that one makes when one has sleep apnea very different from that of someone who snores, Dr. Estrella?
Yes, yes. Usually snoring is like a vibration of sound. But if you have now an obstructive symptoms, more likely there will be a cessation of airflow. So you do like
You're
this.
gasping for
So you're gasping for breath. Parang wala siyang sound. As if nothing happens at the side. But it's now a cessation of airflow and more likely it's an obstructive type of sleep apnea. Because snoring is only a sound
Okay.
that vibrates on the soft tissues of the oropharyngeal area.
Is snoring, yes, Dr.
Because
Estrella.
if you're entertaining obstructive sleep apnea, and snoring is one of the symptoms, you should do a test. We call it a sleep study or a polysomnogram. And then you're able to document if there's a cessation of airflow. You put nasal pressure transducers, you put something in your nose to detect the airflow. And then for about 10 seconds, there will be a flattening of the airflow, meaning there's no air coming in. So they call it apnea. And then hypopnea would be there's still some airflow, but it decreases. So if you're able to get enough of them, meaning in an hour, there are at least 5 of them, then that's already settles the diagnosis of obstructive sleep apnea. But if it's just a primary snoring, meaning it's just a normal snoring, then you won't even have the apneas or the hypopneas. So it will not reach that sort of break point.
If it doesn't reach that break point, then when you're diagnosed, are you diagnosed with just snoring?
Yes,
Yeah.
we call it the primary snoring.
So primary snoring, is it is it a disorder? Is it
could
just
be,
normal?
In a way, if it interferes already with your life, for instance, socially, you might be an object of ridicule, or your wife or your husband would complain about it, then we could do something about
Yeah.
it.
It's a disorder that needs to be addressed. So since we're talking about sleep disorders, doctors, please share with us or educate us on the different types or different kinds of sleep disorders. Dr. Estrella.
Usually we have different kinds of sleep disorders, the dysomnias and the parasomnias. Yes. In dysomnias, it's what we see patients like insomnia, who cannot initiate sleep, who cannot maintain their sleep, or others who have excessive sleepiness, like narcolepsy, or others who cannot sleep because of the leg movement, patients who have, we call it circadian rhythm sleep disorder, simple as patients who are a shift worker, patients who have a jet lag, patients who are sleep so early, we call it advanced phase sleep disorder, and also patients who are delayed type of sleep disorders, who works at night, who goes out with the friends and sleep very early, so they wake up at around 10 or 12 in the afternoon. So that's part of the sleep disorders. That is more or less common.
Okay. Pero others kasi, if they go out at night and then they go home early in the morning, the reason for catching up on the hours of the sleep is that dahil pagod sila. So they're trying to make up for the sleep na hindi nila nakuha for that evening. Is that healthy?
No, it's you sort of just make up for the lack of sleep. So that's not necessarily abnormal. It's a normal way of response to the need for sleep. But what we're saying with sleep disorders, there are certain criteria in terms of how frequent it is, how severe the symptoms are. Okay, so it's not just merely a problem with not unable to sleep well for a night or so.
So unable to sleep well or too much sleep can also be a disorder.
Yeah.
Those are the parasomnias.
Yeah.
There's another...
So if we're going to classify them, it could be a sleep-related problem. Okay? It could be a sleep breathing-related. It could be a movement-related sleep disorder. And then at the two extremes, you cannot sleep, it's insomnia, or you sleep too much, the hypersomnia. Then you have the circadian sleep disorders, and Dr. Estrella mentioned the advanced sleep phase. You sleep too early, like the lolas usually, right? Or you sleep too late, like usually the teenagers. Jet lag is also part of circadian sleep disorders. Then the more interesting ones would be the parasomnia, wherein you have sleep terror, sleepwalking, all those things, REM behavior disorder, even what we call the bangungot, part of the parasomnias.
Are the parasomnias, like the sleep terrors and sleepwalking, are they common here in the country?
You will see very few. During my time as a sleep specialist, I think I've seen only 2 patients who sleepwalk. But I've seen plenty of sleep talking, but it's too short.
So when someone sleep talks, the natural response of the person you're with is to talk back to that individual. Is that correct?
Let them just, you could just let them
Let
wake up.
just talk. Let them just talk. Not necessarily interact with them or strike a trying to strike a conversation because technically they're still asleep.
Yeah, if you want to catch him as may tinatago, baka sumagot.
So that's one good way. What are some of the bad habits that can lead to sleep disorders? Dr. De La Suarez.
The most common sleep disorder, actually, it's not even sleep apnea, it's insomnia. Okay. Especially now when we're sort of obsessed with sleep. So some habits would be people are, since they're so obsessed with it, they keep on looking at the clock, trying to mark out how many hours they've slept already. And that anxiety about not having enough sleep, sadly, would be the main reason why they would have difficulty in sleeping in the first place, because of the too much anxiety about sleeping. And of course, we stay up too late, especially with our gadgets. Okay? So there's a tendency for you to delay the sleep time, the sleep onset. Unlike before, we don't have too much light, so at 6 o'clock you're asleep. But now you have so many distractions. And then if you push the sleep time to early morning, then the more difficult for you to be able to fall asleep. And it really disrupts your sleep time.
So we can't also be too obsessed with sleeping on time, no? Keeping track and jotting it down every day. And coffee, you mentioned coffee.
We wanted to extend our wake time, so we tend to consume large amounts of caffeine. Okay? And for some people, they want to have more sleep, so they also abuse alcohol. thinking that it might help them.
Help them, put them to
Go
sleep.
to sleep, yeah. Initially, probably, but later on, when the alcohol gets broken down to its metabolites, then it might cause disruption or sleep, or even poor sleep.
Doctors, we have a caller on the line, Flordelisa Reyes. Good evening, Flordelisa.
Hi, good evening ho.
Good evening.
Magtanong lang ho ako kung ano yung magandang gawin o magandang gamot kapag nagtagal na ang insomnia, say inabot na po ng buwan.
Okay.
Ganun po.
Okay, salamat po. Yes, doctors.
Yeah, it's not that easy to diagnose insomnia and prescribe the treatment. Really have to have a clinical evaluation, a complete sleep history, because you have to find out whether is this insomnia an acute one? It just happened just a few months ago, or it's been there for a long time, because then you'd be able to get some clues. Is it related to a stressor? Like, let's say someone in the family died, or a major illness, then that might be the reason why the sleep was disrupted in the first place. That's why there's difficulty going to sleep. Or it could be something that could be related to another condition. The patient might have, for instance, a congestive heart failure that makes the patient go to the bathroom every day, every night. We call it nocturia. So you have to investigate. And another thing would be sleep habits. The patient might have poor sleep habits. I mentioned earlier, the bed environment or sleeping environment is too stimulating for the patient to go to sleep. Because usually we put the TV inside the room and then we watch until we fall asleep. So it might be as simple as getting a better sleep hygiene or sleep habits to counteract the insomnia.
You'd like to add?
Yeah, usually you can, you advise patients to take milk because of the tryptophan effect. You can let the patient eat banana. Yeah. And you have to take shower before sleeping.
Okay.
And you don't have to lie on bed just to rest. Okay. You only have to use your bed on sleeping. And another S. Okay. But if you don't feel anything, you don't want to sleep for that moment, you have to sit down, you have to read, because sleeping is very important. So if you want to sleep, to rest, don't use your bed.
Okay.
That's very important.
Okay. Flordelisa?
Thank you po.
You're welcome. Salamat din for calling.
Okay, sige po.
So, your body also has to recognize that when you are not yet ready to sleep, you do not lie down on your bed.
Yes.
In a way, you have to prepare your body to sleep. You have to give clues. That's why if it's already nearing bedtime, then you have to dim the lights probably. Then you have to stop working. Okay? So that's why if you work on your computer, remember your computer also emits light. And light would stimulate the brain to wake up. Okay, so whereas if it's dark, then it will stimulate for it to go to sleep. So you have to give cues, environmental cues to the body.
Okay.
Yeah.
So sometimes also, before we cut to a break, sometimes we have a lot of work to be done at that hour. That's the most productive hour for others at night. And then we'll just tell ourselves, babawiin na lang sa weekend. Will you ever be able to make bawi or to get back that sleep that you lost during the week? Dr. Estrella?
Usually you can, but for a short period of time. But if you doing it every now and then, that will be a problem with you because your rhythm, your circadian rhythm will change. So more likely after a week, you can recover. But how about after 2 weeks, 1 month, if you're doing it every now and then, probably it will change the shift of your sleep, your biological clock. So it will just make you as if you were not able to sleep because of your body clock that wakes you up during the time when you're going to sleep.
Supposed to sleep. Aside from your body recognizing that your bed is just only meant for sleeping, you also have to realize and remember a good and a healthy sleeping pattern, no?
Yes.
Not to be too obsessed with it, Dr. De Los Reyes, like you've mentioned earlier, to keep jotting it down. We'll talk more about, we'll get to a more in-depth discussion about sleeping disorders when MedTalk returns.
When a person snores, it is normal for the muscles at the back of the throat to relax and incompletely collapse while asleep. But when the airways close at prolonged periods of time, such as 10 seconds to 1 minute, then a person may already be suffering from sleep apnea. 27-year-old Joseph Francisco was initially diagnosed with primary snoring disorder with a possibility of obstructive sleep apnea.
After laryngoscopy, pinakita niya sa akin dun sa authorization na ang primary diagnosis ko is obstructive sleep apnea.
A snorer since his college days, he went for a checkup after experiencing sore throat and noticing blood in his saliva.
Actually, hindi ko naman siya pinansin na parang disorder na rin. Parang treated as normal. Sige, lahat naman ng tao humihilik, diba? Ang nag-trigger sa akin magpa-check nito lang, is yung pagsakit ng throat ko, hindi ako mapagsalita, paos. Yun yung dumura ako one time, nakita ko merong parang konti lang naman na red. Ngayon, nung nalaryngoscopy nga, nakita may hypopharynx, may nodule sa vocal cords, and may overbite din. Kaya yun ang nagkakos ng, sabi ni Doc, snoring ko.
Joseph knows all too well the dangers brought about by having sleep apnea and has taken the first step in improving his way of life by undergoing tests and treatment at the Capital Medical Center Sleep Center and by changing his lifestyle.
We're back here on MedTalk, still talking about sleep disorders. You may join the discussion by calling our hotline at 548-4678. Drs. Joseph is your patient, I understand, Dr. Estrella. Very young to have a sleep disorder. Is that at a young age?
Usually this patient is a patient of mine. He's a call center agent. He was very young, 27 years old.
Yes.
But his problem when he visits me is always nasal congestion. I advised him on the first time I saw him that he snores. I accepted it. But through the years, almost for 2 years, it was only this time that he accepted the sleep study. Why? During my flexible nasopharyngoscopy, and because of the Epworth sleepiness scale, he sleeps so much during the day because he was now out of his work because of the sleeping. He was a call center agent, now he's already a teacher.
Okay.
But from there, he still have a poor concentration, less attentiveness to his students, more likely. So that's why he was able to have his sleep study. If you see this patient, he have a short neck.
Okay.
If you see also the bite of the patient, he's overbite. And in this case, if this is an overbite patient, more likely the patients may have a mouth breather because of the nasal congestion, and he is an overbite patient. So more likely when you sleep on supine position or on flat with a nasal congestion or a blocked nose, more likely this opens up, it dries up the throat, by gravity the tongue falls back, and it adds to the obstruction of the patient because of the increase in airway resistance. And for this patient, during my flexible nasopharyngoscopy and during the sleep study, it goes that it's only a mild type of obstructive sleep apnea.
Okay.
He have a moderate to snoring, but the main concern now is his sleepiness during the day because it disrupts his work. That's why when we do the flexible nasopharyngoscopy with Mueller maneuver, we check on the hypopharyngeal area, the retropalatal area, and when we forward it using a mandibular appliance, this one,
Okay.
it forwards the mandible and it lessens the falling back of your mandible, and the lower mandible, lessening the obstruction of the patient.
Okay. Aside from the tests that we saw earlier, kailangan din yan.
Yes, he needs this instead of using other techniques like free snoring mattress or doing the CPAP pressure, opening the oral airway. So for this, when you check on the patients and there's an increase in opening of the oropharyngeal diameter of the hypopharynx, more likely the patient may need this one.
Okay.
But it does not benefit to all patients.
Okay.
So you have to check the hypopharyngeal area. Yeah.
You mentioned his how he looks physically.
The short
you
neck.
mentioned the neck.
The short neck and overbite patients like this.
Okay.
So for that, when he tries to lie down, more likely because of the nasal congestion, it may open the mouth. By gravity, it falls back the tongue, and it adds to the obstruction.
How is he now, doctor, with the tests done at the sleep lab
Yes,
at Capital Medical?
he doesn't have any low oxygenation during the night. It's only about 89, so almost mild type of desaturation. He snores for mild to moderate type, but the problem is because of the amount of this of the mandibular appliance device, it costs around 30 to 50,000. I don't know. Yes, I really don't know if he can pay.
It's quite
for,
expensive.
Yeah, it's quite
yes.
expensive.
So what is the alternative to something like this?
Yeah, it could be a minimally invasive surgery, or patients wants to have a continuous positive airway pressure, a pressure that puts it in the nose, or with a full face mask, opening the oropharyngeal area. But the compliance of the patient of using the CPAP could be lessened because it's only a mild type of obstructive sleep apnea.
Okay.
So better to have a more minimal place in the oral cavity. So this is the most minimal because the patients will benefit from this. Mandibular appliance device.
Mandibular appliance device. Okay. Yes, Dr. De La Srez.
That's the reason why the first thing that we ask the patients if we're suspecting sleep apnea would be to undergo a sleep study, a diagnostic sleep study, for us to quantify how severe the sleep apnea is. Because if it's moderate to severe, then the first line or the gold standard of treatment would still be the CPAP. CPAP means continuous positive airway pressure. Means that there's a mask that you put on your nose and then pressurized air is blown into that in order to open up your airway. So it's the most effective and the gold standard treatment for obstructive sleep apnea. But for patients who are in the RDI or the severity is just mild to moderate, then you could give other options. It could be as simple as telling them to lie down at their sides. Okay. And if they want further treatment, they could also have the oral appliance that Dr. Estrella demonstrated. And for those patients who would like to use CPAP, but they're unable to use it, to tolerate it, because there's a problem with their nose, then you could have adjunctive surgery in order to open up the airway.
These patients, assuming they have been diagnosed with sleep apnea.
Even for children, like it would be different from adults. Like children could also have sleep apnea. Our youngest would be about 2 years old, and you'd be surprised with when you say apnea, cessation of airflow. There's about 1 minute apnea. That's how long it was.
For a child who's 2 years old, that's
but just
long
for a
period
child,
of
for it to
time.
be called an event, it's just 2 breaths. So that's very long. The oxygen went down as low as 40s. The normal is 90. Okay. So, but for children, you might also consider if they could also undergo a tonsillectomy or adenoidectomy because it's those structures are crowding the airway.
Okay.
So it could be different for adults and children.
For children.
Also.
Doctors, we have another caller on the line, Danny Alcantara. Good evening, Danny.
Good evening po.
Good evening. Yung question mo, please go ahead para sa mga doktor natin.
Yes, yes, doctors. I've been experiencing shortness of breath during my first 30 minutes to 1 hour of sleep. And I've been experiencing this for the last 40 years. I'm now 65. So what I did is whenever I experience this short I usually wake up and then I immediately face the electric fan or the aircon so that to regain consciousness. What could you suggest to cure this sleep apnea? Because 40 years na ako nag-experience nito. At hanggang ngayon, I changed my bed from a flat bed to the rocking chair, and I still experience this. I usually experience this once or twice a week. Thank you, sir. Thank you, doctors.
Dr. Estrella.
This is a very obvious patient with obstructive type of sleep apnea. And usually, I don't know the age, but probably if you have a comorbids of heart problem or hypertensive, high diabetes, more likely it will be uncontrolled. So in patients like this for 40 years, more likely it develops complications.
Okay.
So I'm not really sure if the patients have hypertension, and this may lead to stroke.
For this patient, he seems to have also what we call orthopnea, difficulty lying down flat on the bed. That's why he said that he's using the rocking chair. So you also have to consider other comorbid problems like, for instance, heart problem that could cause congestive heart failure. Because difficulty sleeping in bed at night could be caused also by other things. Could be COPD, could be asthma. Okay. But sleep apnea definitely should be considered, especially if this patient has probably the BMI or he's obese.
Yes.
Or he also has other symptoms like snoring, okay, and witness apneas like the bed parter. Would notice that he stops breathing at night. And if he also, when he wakes up in the morning, he feels unrefreshed, okay, not able to function during the day because of the extreme sleepiness. Then these are the things that would make us think of obstructive sleep apnea. So this, our caller, Mr. Danny Alcantara, would benefit from a consult. Then probably a sleep study would be done if obstructive sleep apnea is one of the considerations.
Mr. Alcantara? Okay, well, thank you for calling, Mr. Alcantara. Doctors will talk more about sleep disorders when MedTalk returns.
According to the Wisconsin Sleep Cohort Study, sleep breathing disorders and cancer mortality show an association between sleep apnea and an increase in your chance of dying from cancer.
We're back here on MedTalk, still talking about sleep disorders. Doctors, now let's talk about managing and living with one who has a sleep disorder. How do you continue or carry on knowing that you have a sleep disorder? Dr.
It would really depend on the sleep disorder. Okay. For instance, it's insomnia, then usually we just advise them, we call it a cognitive behavioral therapy. So we advise them that they should have realistic expectations about sleep. That's one. Then teach them probably how to relax during sleep.
Is that done at the sleep lab as well? Teaching them how to relax, how to sleep?
In the sleep clinics, during consult, then we could tell them how to do it. Like, we call it a guided imagery. Try to imagine a place that they feel most at peace with. For instance, imagine they're in Boracay. So sort of remove themselves from the stressful situation. Then in progressive muscle relaxation, we tell them to tense the muscles successively from the neck down to their toes. Okay, and that will also help them to relax. So those are some of the, and then we tell them that if they're unable to stay asleep, then they just have to get out of the bed instead of just waiting for sleep to occur, because that will make them more anxious. And then just go back when they feel sleepy. So that's for insomnia. We try to discourage taking medications without first exploring the other options for that. If it's sleep apnea, then the prompt diagnosis, okay, and for us to be able to classify them regarding the severity, so we could guide the mode of treatment, whether surgical, oral appliance, or the CPAP, which works best for them. And if it's, for instance, restless legs, then it would have a different, you would advise them differently. Like you have to investigate if they really have restless sleep. This is you were asking me earlier what restless legs is.
Yes, restless leg. It's part of a sleep disorder.
Yes, it's one of the movement disorders that happen during sleep, wherein there's an irresistible urge to move their legs. Okay, so they feel that there's some crawling sensation on their feet, and they have to constantly move in order for it to go away. So it happens in the late afternoon or late evening when they're about to go to sleep. So you can imagine you want to go to sleep, but there's something on your legs, and you have to keep on moving in order for it to go away.
Okay.
So that would prevent the patient from going to sleep and falling asleep. And there's some reasons. Most common reason would be probably the iron is low, so you have to check your ferritin levels or iron, if it needs to be supplemented. This is also common for pregnant women, okay, because of also vitamin B complex deficiency, and for renal failure patients as well. So yeah. So we have to explore these conditions that might be associated with restless leg syndrome.
You mentioned explore. How about exploring home remedies? If you know, sometimes they don't have the means to go to a sleep lab and have the tests that you've mentioned. How do we remedy not being able to sleep at home?
In one of our patients who cannot sleep or have the symptoms of obstructive sleep apnea, if he's obese, more likely you have to do a good lifestyle. Don't eat in the fast foods, less of a heavy meal at night. Try to not to sleep anytime during the day, because if you will sleep during the day, more likely it may have a problem with your work. And more often, if patients are snorers, more likely you have to look for other complications, and it could be a series of sleep disorders like sleep apnea. Yeah. So there's still a treatment for that is available.
Okay. And since we're still on the topic of treatment, how about meditation and yoga as a form of relaxation to put the patient to sleep?
Yes, that's also a way of relaxation. So if they're keen into going to yoga, then that could help them relax and hopefully help them to fall asleep better.
And no TV in the room.
Yeah, so sleep environment should be conducive
very
for sleep.
important.
So even for children, you have to tell them not to bring their PlayStation inside the room. Ano pa ba yun? Sikat pa ba yung PlayStation?
I think so, yes.
Meron pa.
iPads, your
those things.
PlayStation, your phones.
Your phones,
Xbox.
computer,
Your Xbox,
your
Xbox.
TVs. Yeah. There's so many distractions in the bedroom, so we have to move them all out. Even the television is a distraction.
Okay, so thank you very much, Dr. De Los Reyes. Dr. Estrella, any final message?
If you need our help, just go to a sleep specialist. Snoring could be normal, but if you feel that you're not having a good night's sleep, more likely you see us, the sleep specialist.
Well, thank you very much for your time, and thank you for educating all of us on how to get a good night's sleep. I hope everyone sleeps well tonight. Thank you once again, doctors.
Okay, thank you.
We'll see you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on 9 TV. Sleep well, everyone. Good night.